how are you? My name's Dr. Morgan. Very pleased to meet you. Congratulations on your pregnancy, first and foremost. So do you want to take a wee seat? That's you, get yourself settled. Lovely. Well, I know you've seen half a dozen people before you've got as far as me. I know how annoying it is, but this is your booking visit, and this will be your longest visit in your pregnancy. So this is where we do all the work basically to get you on the system in the hospital, so that when you come to have your baby, everything is up to date. We have all your details, we have all your preferences and everything, and we can assist you from here. So I'm your consultant, and basically what I do is I oversee everything that's to do with your care in the hospital for the duration of the pregnancy. Any major decisions, should anything arise, anything like that, will be directed to me. I oversee everything. You're a patient of mine, and you are also a part of, let me just check, the Orange midwifery team. So that's overseen by a girl called Laura, I think, and she's lovely, you'll really like her. Just a lovely team here at the hospital, and you'll just feel hopefully so relaxed with us. And the good thing about having a team is that you'll see consistently the same midwives during the duration of your pregnancy, rather than you seeing a new face every time you come here, which can be unsettling, I know. So we like to do it this way. That way you're assigned a team and everything can hopefully run smoothly for you. And that way also, when you come here, everyone, knows you and recognises your face, and it's just nice. So what I'm going to do today is this is your 12 weeks, right? Yes. I'm going to do a few wee things in your notes. Just mark down some general information about you, gather some information. I'll give you a few wee things to do at home for the next time you come to see us. Just things like taking a note of your family history, your family medical history, things like that. I'm going to decide whether you will be in the green team for midwifery-led care, or doctor-led team care. That would be the green or the red team. So we'll assess that and we'll mark you down for that. I have a couple of leaflets and a DVD and things to give out to you regarding breastfeeding and things like that. And I'll also give you an opportunity to ask any questions you like whatsoever. So hopefully you leave here feeling great and feeling all relaxed. And I believe you've already been and got your height and weight, yes. And also, did they ask you for a sample of urine? They didn't. Well, I can give you a wee bottle here, and sure, between now and you're going for your scan next, between now and then, if you just well, actually no, that's not a great idea, because you need to have okay, well, if I give you a wee bottle of urine, even if you just take it home with you and do a sample for the next time you're back here, that should be fine. We don't really need to check urine too consistently at these early stages, but definitely I'll give you a wee bottle here now. Here we are. So if I just give that to you, if you just, don't be worrying about filling it or anything, just basically enough for a dipstick to go in there. If you just put on your surname there, your forename, and date of birth, should be fine. So I'll just give that to you. And if you just pop that back in the next time you come, that'd be fantastic. I was going to say to you, you should maybe do it between now and your scan, but I'm just thinking they recommend that you have a full bladder for the first scan, just to help push the uterus up a bit higher, so don't worry about that for now. Anyhow, so how are you feeling? That's good, that's good. Any symptoms, anything troubling you? Oh, right, okay. Okay. It's not your first pregnancy then, I take it? Your fourth? Right, congratulations. So you're having a bit of trouble with the SPD then? Oh, I know what it's like. I got it myself. Yes, I'm well aware. I like to take it very seriously as a consultant because I personally experienced it myself. It can be almost debilitating. I understand. How are you feeling in that regard? Mostly morning and night. The trouble at the minute. Yep. Is it unbearable? Are you going to need some crutches at this stage? Because we can absolutely organise that for you. I will have to put a referral into a physiotherapist, but I can get the crutches today if you're in a lot of discomfort. Okay, you're doing alright for now then? Okay. Well, as I say, just get on the phone to us, let us know. I'll arrange for the physiotherapy department to send me up some crutches and we can most certainly loan them to you for the duration, if need be. In the meantime, I will make a referral. And are you able to cope on just paracetamol? Because that's basically all really I can give at this stage, Paracetamol, fine. Obviously, as it gets a wee bit worse, I can maybe give you a bit of codeine, cocotamol mixed, paracetamol and codeine mixed. I mean, it can cause a bit of constipation, and it's not as safe as paracetamol, but when we weigh up the risks and you're in severe pain, it would be definitely something I would give you. Okay, no problem. So anyhow, I'm just going to, if you don't mind, I'm just going to bring up your, details here. And I'm just going to make a wee note of the SPD just for future reference, because I don't want that to go untreated. I know how severe it can be. Okay, and I'm just going to arrange for a wee referral for you there. Okay. So there's not a whole lot to do in this section, you'll be pleased to hear. Basically, if you go to your GP, if you make an appointment with your GP midwife, it'll be one of the girls from the hospital here, but they calls into the GP surgery every week. I think it's every Thursday they go to yours, and if you just call in there and make an appointment, basically. If you take this home with you, this is your antenatal record, and this is what you will use for the duration of your pregnancy, and we will basically document everything to do with you in that book. And if you take that everywhere with you, just make a habit of having it in your handbag, in the back seat of the car, everywhere you go, because basically that's going to contain everything to do with you personally. So it'd be great if you could take it everywhere, and that way we have all your details when we need them. Right, next up, I'm just going to give these to you. The first is this DVD, and this is basically about talking to your baby in the room and listening to the sounds and the kicks and things that your baby does. It's a really good way of learning to bond with your baby at a really early stage in your pregnancy. So I'll just give you that. Next thing I have here is, because you do have some mental health issues, this booklet deals with mood disorders during pregnancy and postnatally. So I'll just give you that. And that basically, it gives some tips and pointers if there are things that are really troubling you and you can't deal with. Rather than you feeling that you're alone, we really would need to see you back here and consider possibly starting medication, or I know that your problems aren't they're very important to us, but they're not too serious that they can't be handled. So we have a mental health team here, and we can make a referral straight away if it's needed. So if you need that, just let us know and we can do that straight away. I'm also going to give you this little leaflet, and this is for free milk, fruit, vegetables and vitamins for you and your family. If you're on a low income, or if you have children under 4, it can help with the cost of fruit and vegetables and things, and it provides you with vitamins antenatally, postnatally, and also for the baby. So if you just bring that to your midwife at the clinic, she'll fill that out for you. Now, I've decided that I'm going to place you for now in the amber care section, midway between green and red, because although you don't have any immediate complications that are going to affect the baby, I'm a wee bit concerned about the mental health issues, and I would like to keep a wee eye on that. So being in the amber means that if things progress well and you're happy and everything's going well and later on in the pregnancy, then we can change you back to the green, which is basically you'll be with a midwife-led team rather than the whole doctor-led team for delivery. So basically you won't be considered high risk, so then things won't be as complicated for you. There won't be as much paperwork involved. So you're amber at the minute until we see how you go, and we'll review that later on and see how you go with that. So is everything okay? Are there any questions you'd like to ask me? Anything at all, I don't mind. Yes, absolutely. There will be lots and lots of opportunity for you to discuss pain relief, to discuss everything, all aspects of labour. That will all be dealt with. It's not so important right now at this stage because it's still quite a few months off yet, but there will be every chance, every opportunity. Your wee booklet I'm going to give you before you go. There's a lot of tips and pointers in the back, and there's also a section where you can write your preferences for the birth plan, where you can write, things that you're comfortable with, things that you're not, and we'll take that into consideration on the day, for sure. Anything else? It's most definitely something we would consider if we feel that the SPD is just too much. Then we most certainly will consider an early induction, maybe a week, 2 weeks early. Definitely, if you're ridiculously uncomfortable, it will most certainly be something we'll recommend. I can arrange it for you. Yes. So is that? Do you think is that everything for now? I mean, if there's anything else you need to know, if there's anything that I haven't covered, or you feel I haven't covered, please feel free to come back to us. Please feel free to speak to your midwife in your GP surgery. She's linked with us anyhow. She'll be part of your orange team, and we all interact, so there'll be no problem at all in getting back to us. I want you to feel as comfortable, as safe, and have as happy a pregnancy and delivery as possible. Okay, well listen, it was fantastic to meet you, and I really wish you all the best, and I'll see more of you in the future. Alright? Okay, take care of yourself. Bye-bye.